who will share with us the MCDC experience on the EIOS initiative. Please give a round of applause to Mr. Anwar Abubakar. I'm also delighted to invite here Dr. Philip Ngere. Dr. Philip Ngere is an epidemiologist and the national coordinator at EIOS, the national coordinator for event-based surveillance and the national focal point for the Epidemic Intelligence from Open Sources Initiative at the Ministry of Health of Kenya. Dr. Ngere will share Kenya's experience on the EIOS initiative. Please welcome Dr. Ngere to the podium. I am also delighted to invite Dr. Blanche Cramer. She is the interim lead for alerts and verification in the Public Health Intelligence Unit at WHO headquarters in Geneva. With several years of experience in public health surveillance and intelligence, Dr. Blanche will also share with us how WHO is using the EIOS initiative for early detection and response to global health threats. Dr. Blanche, you are welcome. We are joined online by our colleague from Africa's Centers for Disease Control and Prevention. And so I'm pleased to introduce to you Madam Mercy Kyeng. Mercy Kyeng is the lead for Epidemic Intelligence Unit at Africa's Centers for Disease Control and Prevention. And she will share with us here also Africa CDC's experience on since joining the EIOS initiative. So Madam Mercy is not here in person. She's joining us online. Mercy, could you please put your camera on and just wave to us, and then you can just give a hand of applause to say welcome. Mercy? Can you hear me? Great.
Yes, I can hear you. I'm here. Thank you.
So we have a set of questions. We have a set of questions that we are going to be posing to these panelists who are here with us to share their experience. So each of the panelists will have 2 minutes to respond to the questions. So we have a round of 4 questions, and after that, we will turn to the audience for comments and questions. Again, we ask you to be very brief in your question and very clear. At least within 1 minute, you must be able to clearly pose your question. So I will start with our panelists. And the first question will go to Mercy, who is online. Please tell us, in what context has the EIOS initiative been used at the Africa CDC? And how has it been tailored to address your specific public health surveillance or intelligence need? Same questions with regards to your specific organizations, how you are using this EIOS initiative. So Mercy, over to you, and then 2 minutes for Anwar, 2 minutes for Blanche, and 2 minutes for Dr. Philip. Mercy, over to you.
Thank you so much, George, and thank you for the opportunity granted to Africa CDC to be part of this very, very important session. So just to stream you back to what Africa CDC's mandate is, our mandate as a technical agency for the continent, or technical public health agency for the continent, is to support and strengthen the capacity of our member states to be able to detect, prevent, and respond to public health threats promptly. I'll end by saying promptly again, because it's really very important that these keywords come out clearly. So as you know, we have 55 countries that we are supporting. And for us to be able to better operationalize and attain our objective as an institution, one of the things that we are putting in place is a strategy to support the continent to detect threats and respond to these threats also in real time. So the EIOS comes handy, and since 2018, since we're onboarded on this platform, actually we're part of the coordination group for this initiative. We have been able to set up a mechanism or a board spanning across all our 55 member states that helps us to detect what is happening. And sometimes we are the ones supporting these countries to provide this first-hand information and get feedback on the same. The second very critical area that this has really been very beneficial and what we're using is around partnership and collaboration. So it's really strengthening our collaboration with other stakeholders in also achieving its mandate. Remember, no one is safe until everyone is safe. So it's also supporting cross-continental collaboration with other partners like European CDC, Robert Koch Institute, and the rest. And it's really helped to be able to build these very strong collaborations. And again, one of the things that maybe I'd want to also highlight is the fact
30
that—
seconds, Mercy.
Yes, it's the fact that we also have regional boards that are tailored to the different regions on the continent, the eastern, the northern, the southern, and it's helping us to really understand what is happening within the different regions, and as well share this information across these different regions in time. Thank you, and over to you.
Thank you, Mercy. So Anwar, tell us, how are you leveraging EIOS initiative at Nigeria Center for Disease Control and Prevention?
Okay, thank you very much, George, and to WHO for this opportunity to share our experience with the wider EIOS community. In Nigeria, the Nigeria Center for Disease Control is our national public health institute with a mandate similar to that of Africa CDC, but only ours is to prevent, detect, and respond to public health threats happening in Nigeria. So at the NCDC, the EIOS initiative has been very instrumental in enhancing our epidemic intelligence capabilities. Essentially, we have, as the first country to be onboarded onto the platform in 2019, we have already integrated the EIOS into our signal management metrics. So these signal management metrics actually define our workflows around sniffing for signals across different media monitoring boards, also detection, reporting, detection, verification, analysis, and reporting. So basically, this is how we use the platform. And then in the context currently in Nigeria, we have 6 bots we are using to monitor signal of interest in the EIOS platform. So we have the all priority signals, which our team actually using to detect signals around priority disease as defined by our risk mapping, as well as our IDSR strategy for Nigeria. So in addition to that, we also have the all hazard monitoring board, where we have stakeholders from, where we monitor signals from human, animal, and then coming from environmental sectors. And then of course, we have a very interesting board, epidemic prone disease in and bordering Nigeria. So remember the first case of Ebola we had was imported from Liberia. Since that time, we have learned to be careful of what is happening across our neighbors. So because of that, we now have a board specifically monitoring epidemic prone diseases across Nigeria's border. And we also have a board that's also monitoring, we have a board monitoring AMR surveillance. And then we also have we also plan to have a lot of boards that can manage, monitor disease-specific signals that are coming across Nigeria. Thank you.
Thank you, Anwar. So we'll now go to Blanche from WHO headquarters.
Thanks very much, and I'll echo what colleagues have said. I'm very grateful to be here and to be listening to the really rich conversations that's happened the last few days. So from the WHO headquarters side, we have been involved with the EIOS Initiative for obviously quite some time, and we are a member of the coordination group. But in terms of our implementation and integration of the system into what we do on a daily basis, we use the team that I work with uses EIOS for our routine surveillance. We conduct EBS with 2 analysts on 2 boards, scanning between 3,000 to 4,000 articles a day. So it's quite a big piece of work that we do. And this has evolved over time, increasing the use of EIOS for our routine EBS. In addition, over the past few years, particularly with the advent of the COVID pandemic, we have started to use EIOS for additional purposes. So in addition to what we do routinely, we have added boards that we established specifically for monitoring of mass gathering events. So the Olympics that are ongoing, well, I guess the Olympics ended and the Paralympics are starting. We set up boards specifically to monitor for those events, which are typically the priority hazards that we would look at normally, in addition to some of the mass gathering specific types of things that we would need to consider, such as stampedes or heat and climate-related scenarios that might occur when there's a large group of people in a particular setting. We additionally have started to use new boards where we look at collecting its more contextual information. And again, we did this with the advent of the COVID pandemic, looking to try and get additional information beyond the typical EBS. So we used it to
30 seconds.
Look at things like public health and social measures that we wouldn't collect through our routine data, as well as sort of health system capacity monitoring. And we found the system quite a useful tool for keeping an eye on those things when we were trying to assess the situation in countries. We also have a number of teams at headquarters outside of the Public Health Intelligence Unit within which I sit that are using it for their specific programs. So this includes food safety, medical falsified products, humanitarian teams, arbovirus teams, deliberate events teams, and attacks on healthcare worker teams, just to name a few. So you can see there's quite a breadth of subject areas that are being used with the EIOS. Thank you very much.
Thank you so much, Blanche. So we'll go to Kenya. Tell us, Dr. Philip, how are you leveraging the EIOS initiative?
Okay, thank you so much, George, fellow panelists and colleagues in the room and those who are online for the opportunity. For Kenya, EIOS is part and parcel of our media monitoring process. The program is it forms part of the media monitoring module of our event-based surveillance system. We therefore use it for to strengthen our early warning systems, detecting outbreaks, and also to monitor these outbreaks as they evolved once they've been confirmed. To that end, we have colleagues who are members of the community who routinely and in a scheduled manner do the media scanning on the platform, pick up alerts, and ensures and follows them up so that they're processed and verified and where need be responded to. When outbreaks or public health threats are confirmed, of course, we again form boards that then focus their monitoring as they evolve. I want to also add that I think all of us are aware that sharing data is a problem across borders. It's not easy as much as we work together. But through this platform, we are able at least to informally also scan around, get to understand things happening in the neighborhood, in the neighboring countries, and therefore, through that again, strengthen our cross-border surveillance systems so that as much as we may not have a formal report from a neighboring country, we are able to pick up things that are likely to lead to threats within our borders. Thank you so much.
Thank you very much, Dr. Ngere. I think this is quite useful. Just listening to all of you, Mercy, Anwar, Blanche, Philip, you've been there for a long time with this EIOS initiative. So to begin with you, Mercy, tell us, how do you measure success since what's your measure of success since joining this EIOS initiative? Over to you, Mercy.
Yeah, thank you so much. And what we'll consider a measure of success, or what we'll consider a milestone worth celebrating because we are using EIOS, is the collaboration. That won't occur, that won't happen in a normal day, on a normal day that we get to understand what is happening across the continent and get to galvanize efforts to be able to understand some of these threats, assess these threats, and really rank these threats together, support each peer-to-peer support coming in from different institutions. I mean, this has really been one of the things that we really applaud the system for helping us, not just the system, the initiative for really helping us attain. And I give you an example. Last 2 weeks, our team was in ECDC, and we're all sharing experience on how to do mass gathering monitoring. And this is something that as a continent, we've really not been big on, but through the EIOS, we're able to work together with ECDC to get to understand how that was done during the in the ongoing Olympics. And we're hoping to bring that lesson back home during the CAN coming up. We definitely are going to set up some sort of mass monitoring for the same. The second one is the peer-to-peer support and information exchange. On a normal day, we might not be able to understand how a case of cholera, in maybe say Comoros goes to maybe one of the islands of France and or the colonies of France. We might not be able to monitor that at the continental level and understand the gravity of how these threats or diseases spread quickly. But through this platform, we have also been able to get a very bigger picture of how some of these threats occurring on the continent pose a bigger threat to the globe. So I think it's really been some of the successes that without this, it would have really be challenging to really get to understand. So I would repeat: one, peer-to-peer support; two, is a collaboration.
Thank you, Mercy. Anwar, you've been there since 2019. First country in Africa to be onboarded to this initiative. 5 years now. How do we measure success?
Thank you, George. Actually, we can actually measure success of this initiative in Nigeria, looking at the signals that we pick and then the specificity of those signals. In the last couple of months, almost all the signals that we pick from the EIOS turn out to be actual true event upon validation. So this gives credit to the specificity and the effectiveness of the platform in picking up signals. And then one of the most important goals for public health surveillance is to get information for action. Through EIOS, we are able to identify cases early and activate our response system almost immediately. And for us in Nigeria, we don't just pick the signals and then keep it in our laptop or in our logbook. Immediately, every day, I don't know the time now in Nigeria, I think, okay, in about, by 3 o'clock every day in Nigeria, we have a daily public health intelligence meeting where we review the signals that were picked across EIOS and other media monitoring tools like Data4 and SITAware. All of these things are reviewed daily, and then we produce report for senior leadership on that day. And then every week, we now began the process of developing a weekly epidemic intelligence bulletin. This is like a summary of all the signals that were picked across our different media monitoring tools, such as the EIOS. And then we also share this with the top management for decision making. And also, if you look at it, we scan a minimum of 300 articles daily from our SysBot, and then from there, we're able to generate all the needed information that we need to take public health action.
Thank you, Anwar. Blanche, you are responsible to protect global health. So tell us, how are you leveraging? What is the measure of success since joining this initiative?
I would just say that I think global health is a lot more protected with this initiative because it's bringing together so many people. And yes, WHO is mandated, but it is not just us acting together. I think looking back over the past, excuse me, not fast, it is fast, 5 or 6 years, some of the indicators of success that I would think about for us as users of the system as well as participants in the initiative is we're using the system more consistently and comprehensively. When I first started, it was one user on boards that were not particularly well defined, and it wasn't used consistently within the same approach. And now we have a very robust and systematic approach to the system. It's integrated into our routine work. And I think the second thing that really comes to mind is the increased demand for EIOS within headquarters, not just within the public health intelligence team, but as I mentioned in the previous question, or the response rather, we've got other teams who are doing different things who want to use EIOS and to work and collaborate with us to use the information from the system to support their response work or their readiness work or their preparedness work. We also have started now at headquarters, given this increased demand, a network of EIOS and EBS users at headquarters to try and take that increased demand and the increased number of users and see how we can collaborate and connect and streamline and deduplicate. And I think the fact that that is a need is a really good indicator of the success we've had.
Blanche. Let's go to Kenya. Let's hear from Philip. Tell us,
Yes, George.
how will you measure success?
Yeah, I think the simple fact that we've had public health threats, outbreaks, disasters picked up early through the system is a manifestation of success. But our story in media monitoring as Kenya, I think by far is our biggest success that we would talk about. Kenyan story in media scanning dates back to 2010 when we started media monitoring. We set up within the EOC screens, we had set up desktops, we had set up, we had radio systems that we are listening to, we were getting deliveries of newspapers to read. So we were doing media scanning and it didn't work. Because the amount of resources you need to operationalize that, the amount of resources you need to, human resources you need to make that happen, considering the channels, the newspapers, the FM stations, it didn't work. We had nothing to show for it. Come 2019, when we rolled out EBS, of course, this again was a very important module in the EBS system. We are looking at social media this time again. We didn't have much to show for it. But when we got onboarded onto the EIOS platform in 2022 October, we had access now to this automated system that can then remove the human involvement in the media scanning, and we have this automation that can give us products. I think if you ask me today, I can show some outputs that we've gotten from the system. So that to us is a successful story for the country. Thank you.
Wow. Very good. We've listened to you, how you're using the system, what you consider to be your success, but I guess there must be some challenges. So, Mercy, are you there? Now, as a
Yes.
continental organization, tell us, what has been the challenges? What challenges have you encountered with the EIOS initiative?
Thank you so much for that question. And I think that's really very important. One of the challenges that I really want to highlight is data governance. And we all know that effective data governance would ensure that data is consistent and also trustworthy and not misused. So I think that is one of the issues around EIOS, whereby the data that is streamed in, how do we ensure that it's not being misused by, just everybody, by just anybody, sorry. And I think maybe that's one of the things that we need to really look into. The second is around, decentralization of the support to the system. I think I'm really looking forward to a day where we have some sort of capacity on the continent to support with managing some of the glitches rather than going all the time to say Geneva or to Berlin to get some issues resolved. So we're looking at that kind of decentralization of capacity as well as good data governance around the system as well. So with this, I think those are the two critical challenges that we've seen, and those two are my recommendations to see how to move that forward. Over.
Very important. Decentralizing the capacities and data governance. Very good. Anwar, let's hear from you. NCDC.
Okay, thank you, George. So basically, the challenges we encounter in engaging with the platform can be summarized into 3 or 4. If time permit me, I will expand. So the first one we have is we have suboptimal engagement of the system by community members. And this can be due to the staff attrition we had. For example, in 2019, we have 18 people that were trained and onboarded, and currently we have around 3 people remaining in the country that were actually trained that time. So we really need to train a lot, and then to keep engaging with community members to see how we can engage with the platform properly. Then we also have the issue of language barrier. Nigeria is quite a big country. We have over 250 languages. And of these languages, we have 3 languages that are quite advanced with a lot of literary works, well-developed languages. So there are a lot of sources of information that we could actually get from these languages, but then we don't have the capability for it to be translated onto the platform. And then also the technology. It's not easy to navigate around the panels on EIOS in a low bandwidth environment. So these are some of the challenges that hinder that effective engagement with the platform. And of course, the size of the community members too. For a country as big as Nigeria, we have about 13 community members in the EIOS. And you know that the country is like, we have a country of countries. We have 36 states in Nigeria, and some of these states are the size of 2 countries in Europe. But then they also have their own health department. They have their own public health emergency operations center, but they don't have access to the EIOS system. So everything is done at the national level. So I'd consider that a challenge for penetration and then expansion of the initiative.
Thank you. So Blanche, tell us, what are your challenges at a global level?
I think there have been a couple that have really become more pressing in recent times. One that I think many who are users of the system might relate to was the volume of articles at certain points in time, particularly at the start of the COVID-19 pandemic. With the recent Mpox pandemic, the volume has become just so big that we've had to exclude those categories from our boards, which then we do have other teams that monitor those, but it can initially pose a challenge in terms of being able to be systematic and continue our routine processes. Additionally, there are more sources that are added to the system. They increase the number of articles on our boards, and as I mentioned, we only have 2 individuals who scan all those articles, so it becomes not quite so sustainable, and we need to figure out what strategies we can use to make that sustainable. We also don't have what I'll call a quality control plan in place. So I think those of us in the room who've been going through some of the
challenges, connectivity issues, ICT issues, challenges as well. We have minimal buy-in as well. Remember, I think like any other place, we have these changes in leadership over time. And every time you get new people taking up responsibilities of management or leadership, then they need to be brought up to speed. So before then that happens, then you get yourself in a situation of not so much of buy-in, and that translates into minimal support. Thank you.
Thank you, colleagues. I think it has been very interesting so far. Just listening to the challenges you've mentioned. Now, we are moving forward. We are looking into the future. What will you propose as some of the sustainable ways we can build on what we already have and overcome some of the challenges, taking advantage of some of the opportunities that exist today? How do we leverage innovation to make EIOS work better? So, Mercy, let me hear from Africa CDC. What would you recommend? What do you propose?
Yeah, I thank you so much, by the way. And I mentioned two challenges: one, governance, and two was the issue around decentralizing capacity to be able to support with managing some of the system maintenance and glitches on the continent. And we already see that WHO has several offices. I see the Senegal hub is there, and it's coming with some sort of capacity for analytics, and that could be leveraged and capacity for the continent belt, such that if any continental partner has issues, we could quickly get support. And because I'm saying this because there was a time where Africa CDC were locked out of the system for 3 weeks, just because we transitioned from one domain to another, and it took quite a long time for that to be resolved. So I think these are some of the things that we need to look into. We also have Africa CDC also spanning beyond WHO, creating that universal ownership of the system, and getting other partners to be on board and come with capacity to be able to support and strengthen the system in terms of maintenance, in terms of capacity building, these different expertise also, and opportunities can be utilized. The third is also ensuring, of course, I loved what my colleague from Geneva said. There's a lot of information coming in, but how do we create a second level of verification, even if not really robust, but at the meantime, just a level of vetting that can also support us to get more sensitive and streamlined information that is somewhat authentic. I'm not saying what we are having is not authentic, but I'm saying that we could also put a second level whereby we have information that is somewhat semi-verified or validated. And again, if data use, I think that's also very critical. How do we ensure that we don't just get signals, but we get signals that there's some sort of analytics to it, whereby we get information that has been pre-analyzed and assessed, so we could put all these automated processes and get some. So this would ensure that if I'm looking for just some sort of high risk event, I already have it in the section where I can go to and see how it has been assessed through some sort of automated kind of algorithm, and I can get those high risk. If I'm looking for moderate, I can see. So these are innovations that we could be able to factor into the system that would ease the work of the experts, and we all really be doing so well with the system than just picking information and still have to start from scratch to start assessing. So that would be my recommendations. Back to you, George.
Thank you, Mercy. I think this is very, very insightful. What I get from you, leveraging more data science analytics in our region to make EIOS work better for us. Anwar.
I also agree with Mercy. We really need to leverage on artificial intelligence and data science to see how we can improve the precision and then the user interface and the output from the system. And then in addition to this, our specific challenges that we mentioned earlier around the need to expand the community through continuous training and retraining, and also they need to onboard colleagues from the subnational level who are also managing public health emergency operations center with a similar function of epidemic intelligence, and that serve as our gateway for early warning system. These are structures that we also need to on board to ensure sustainability and then continuous engagement with the system. And of course, we mentioned about the challenge about local languages. It's good if you can also have a translation for some key languages. It's not possible to do all the languages, but the major languages that have advanced literary features can be incorporated into the platform. And then I'm happy to learn about the AI that now exists that can allow interoperability of the system and then our event management tools that we use. So this is a very good opportunity, and I think it's good if we all leverage on that to see how we can integrate the detection and documentation in a single platform, or how we can do that seamlessly to ensure we have a seamless detection and then documentation of signal speak from across platforms. Thank you.
Thank you very much, Anwar, for this. So Blanche, this global collaboration, how do you see it going forward? What do we need to do with this EIOS initiative?
You emphasize the word collaboration, and I think that's one of the directions that we're really focused on with our use of the system and the involvement with the initiative moving forward. As I've mentioned, we've seen a massive, maybe not massive, quite a bit of growth in the number of people who want to use EIOS at headquarters, and the increased adoption of it across the different levels of the organization. So one of the things we would like to look at is how do we collaborate and coordinate, looking at our EIOS use across the different levels of the organization to see if there are ways in which we can more seamlessly support each other and build off of the work that each other is doing in an effort to be more conscientious of limited resources that we might have and share lessons learned. So I think that is one of our key priorities moving forward with this. I mentioned before as well, the lack of an integration with a signal management or event management system. That's another priority that we have that we hope will improve our ability to collaborate and integrate the outputs from the various teams across WHO who are using EIOS. I think one of the things that we would like to see, whether it is in EIOS version 2.0 or maybe in a future version, is enhanced communication capabilities within the system that might help us facilitate some more of the verification and validation functions that we have within our public health intelligence processes. Another area we'd like to see enhanced would be the contextual data or the resources for triangulation. So perhaps the integration of official sources into the EIOS system. So if you see an article, you could be redirected potentially to the official source and see if there's any reference of it there to know perhaps more quickly if that unofficial information is actually also officially available. And the last thing that I will mention is that we are working towards developing a global framework for how you could operate for operational public health intelligence. And I think that will maybe again help towards this defining our ways of which we collaborate using the EIOS system to enhance public health intelligence. Thank you.
Great. So let's come back to Africa. Kenya, tell us. Yeah, thank you. How can we move forward with this? What do we need to do?
Thank you, George. I think for us looking forward, a number of things come into focus, and allow me just put them into two groups. Some opportunities that we have or we see where we can strengthen the processes, and also opportunities for innovations. So first, collaborations, and all, we've all mentioned this. I think for Kenya, it is the way to go. We need to strengthen our collaborations for One Health and all hazards, so that beyond now, it is not just George's face and Mercy's face that we see when we mention EIOS, but we're able to see beyond the two faces. We need to think about engaging, more engagement with the community members so that they're actively involved. We need to think about engaging the subnational levels, like Nigeria. We also have subnational governments that are semi-autonomous in a number of aspects, including even service delivery activities. So whenever we do EIOS activities at the national level, it means you have to keep in touch with them to initiate the processes of verifications and initial risk assessment and investigations. With poor engagement and onboarding of these subnational levels, then it means we cannot effectively carry out these activities. We have to do advocacy for visibility, advocacy for buying, and advocacy to support resource mobilization so that we have this system running. Finally, I think like the rest of us have said, innovation is the way to go. Looking at the volume of work that needs to be done, even with automation, the articles that we get that we need to look through are so many. So I think we'll be looking forward for support towards this end. But we've already initiated discussions and guidance has been provided to us on how to work around having APIs that they can automate the linkage between the EIOS platform and our event management system, or the platform that we use for EBS that we've christened them Darura in the country. Thank you.
Wow. Actually, you will agree with me that this has been really interesting, right? Some of the thought processes, some of the things you share. So maybe now we go to the audience. Let's start with our online colleagues. Please, can you share, if you have some burning questions or reflection, just let us know. Please post your question in the chat and we can, and then we'll pose these questions to the presenters. Is there any question or comment so far? I hope you can hear us online. I guess so. So let's turn to the room. Colleagues, any critical reflection or comments for the presenters? Be very brief. Precious from Zambia.
Thank you so much. And I would like to appreciate the responses given by the panelists. It's really enlightening and encouraging to hear what is happening in these countries and even at global level. But my question goes to Nigeria, the CDC Center. I've heard that they do their media scanning on a daily basis and they have a need to review their findings for that particular day every day at 15 hours or 3 p.m. How effective is it to get feedback from where you send the daily report to the higher levels? Thank you.
So we're going to take a couple of questions or comments, and then we'll ask the panelists to respond. Michael from Ghana.
Thank you very much for the opportunity and commendations to our panelists. And mine will go to our colleague from headquarters. Thinking about initiatives, it gets pushed down through, let's say, WHO to the ministries. And here I still have One Health in mind. And if we are to get other stakeholders on board, it becomes very difficult, all because of theft protection. Is there a way that, even at the global level, our stakeholders in country, looking at their colleagues at the global level, they understand these initiatives already? They've pushed down the concepts to their agencies in country. So when WHO or the Ministry of Health is reaching out to them, it doesn't become very difficult. There are several occasions where you will see the animal health colleagues report issues globally before even sharing with national colleagues. Or national colleagues may just happen to chance upon it, but they see it very mandatory to report to their colleagues globally, more than horizontally. So I want to see whether there's that kind of mechanism, which opportunities exist for such mechanisms to be put in place, even at the global level, so that it transcends down. Thank you.
Thank you, Michael. Any other hand in the room? We have a question online from Valerie. What sort of innovative ways are there to include more sources from the region onto the platform? I've heard of this project to include information from radio stations, but haven't heard much of the progress. Are there any ways to include more sources from the ground? Mercy, Valerie, is this question for any of the panelists, or they are just free to respond? Okay. Let's hear what you think about it. And then probably some of these questions can be addressed by comments in the room as well, responses in the room. Okay. Anyone else from the room? Yes, Emmanuel from Nigeria.
Thank you for this opportunity. I just want to make a comment or question to my colleague from Nigeria. Looking at the fact that recently the districts or the local government area are receiving their autonomy, which is very, very critical for public health response at that level. What are the advantages that you are seeing you can leverage to be able to push EIOS to the district level or the local government areas having received their autonomy? Thank you.
One more from Uganda, and then we'll go to the panelists.
I would like to thank all the presenters. My question goes to Dr. Blanche. It's kind of related to what Michael asked. And okay, we know that you have a lot of, what should I say, other international entities that you actually work with or are part of the EIOS community. For example, the Food and Agriculture Organization. And so I'm wondering, since we've had a lot of talk about One Health and being able to work with different sectors in our countries. So I'm wondering if you could actually strengthen this collaboration at that higher level and then have all these people very involved so that it will make it easier for us at the country level to also be able to have a One Health kind of engagement. Thank you.
I guess we have the EIOS core team in the room, those who are actually working on this initiative. So at some point you might want to make a comment to respond to some of those questions. So back to you. We'll begin with you, Anwar.
Questions for this question. So yes, the purpose of that meeting that we do daily is to really categorize the information, the signals we pick into two groups: the essential element of information and the critical information requirement. So basically, the critical information requirement is what gets to the senior management because that requires mandatory action. For the essential element of information, we basically needed to just for situation awareness. So that is how we categorize the information and prioritize which information got to them for decision making and which one is for situational awareness. So it's quite easy and sustainable, and we don't make it bulky. That's the purpose of having the signals, reviewing them, categorizing them to make it very easy to give a spot situation of the to the decision makers. So I hope I've answered your question. Then to the question from Valerie, I want to attempt and then make a suggestion. So yes, we did an exercise this morning to review how many sources we have in each country. And we noticed that for Nigeria, we have about 141 sources of information. And so we were able to have some suggested up to 21 for our country. However, if you look at our homegrown media monitoring tool, which predates EIOS, we call it Tata4. It has over 1,000 sources on that platform. So integrating that Tata4 with EIOS will actually make it very seamless to leverage the sources we have on to also be used in EIOS. And I heard Kenya mention that they also have their own media monitoring tool. So sources from these media monitoring tools that are homegrown in our countries can actually be leveraged to expand the sources that are available for EIOS. Then Dr. Pembi asked a very interesting question about local government autonomy. So for context, in Nigeria, we have 3 levels of political jurisdiction: the local government or district, the state government or province, and then the national government. So in our constitution, each of these levels have responsibility for legislating for health. However, this has not been put into practice, especially at the lower level, while the middle level subsume their funds and also their responsibility, and then they became just like an appendages. So now we have a legislation, a ruling that said that, okay, this local government can actually have their funds directly for them. So this should be a very interesting scenario for us in public health, because we all know all outbreaks are local. COVID-19 did not start in Beijing, it started in Wuhan, not, is it Guangzhou? It started in Wuhan. So all outbreaks really are local. Having the local level, having resources to respond to this outbreak is an important leverage that we can use to strengthen the health system. In NCDC, we already had a plan to see how we can scale down or cascade the Public Health Emergency Operations Center at the local government level. Currently, we have a national coverage. Every state have a functional Public Health Emergency Operations Center. Our next step is to go down to the district level to also have a mini Public Health Emergency Operations Center that is networked with the state EOC and then the national PHEOC. So this is a very good opportunity for us to see how we can integrate all the systems that we have at the national level. We can actually integrate all of these things so that the local government EOC can be a reflection of the national EOC. It will have a similar capacity, but then limited scope in operation. So we are going to leverage on that opportunity to see how, I'm optimistic, but then, so let's see how it goes. Yeah.
Great.
I want to thank you for the questions related to One Health. I oversimplified in going through sort of how we use EIOS within headquarters. Our routine process actually includes colleagues from the GLUES initiative, which is the One Health initiative. We have 2 team members at the moment who sit within the Public Health Intelligence Unit, and they link directly with the GLUES platform, which is an information sharing platform with FAO and WOA. And so on a daily basis, we have integration and information sharing directly with our signals and from FAO and WOA signals in terms of our routine process. So when we identify a signal that might be relevant for animal health colleagues, we will share that on the GLUES platform with them. And similarly, they will share back with us. We also do quite a bit in terms of requests for information or verification through GLUES colleagues as well. I think talking about sort of how we can integrate more at the initiative level, I will leave that to our Berlin colleagues because they do more with that. But I know FAO and WOA are involved and have been working on the integration within their own organizations. So there may be other touch points that can serve as inroads for collaboration across the various levels, depending on where they are with their implementation of the system and the initiative within their own organizations. I hope that answers your question, but I'm happy to try and elaborate more on our One Health components, but maybe Berlin colleagues want to add.
Okay. Just before coming to our colleagues, there was a question about the need to include more local sources. Any one of you want to weigh on this? Mercy, Philip?
Sure. Can you hear me?
Yes, please do.
Yes. So one of the things that as Africa CDC we are doing to help countries have more local sources is during the adaptation of the event-based surveillance guideline that Africa CDC is supporting countries to do. One of the things that they get to do in group is to come up with those local sources that can help them detect. We we put or consolidate those lists and ensure that what we are pushing for is when they are about to be onboarded, these sources are presented to the EIOS core team so that it can be integrated into the system. But I think there are going to be some challenges, which I know maybe the core team is already thinking around, which is about the local language. And if you could hear Nigeria speak, Kata4 has been kind of adopted in such a way that even the local languages, they are able to pick those signals from it. And I'm sure that maybe as we look at augmenting the system to ensure it's more sensitive, we also have to start thinking of how do we get some of these sources that are not in English or in some of these mainstream languages translated to improve detection or customized to the local context.
Thank you very much, Maxi. Philip, you want to weigh in on this?
Thank you so much again. Maybe I just want to respond to this by speaking to the exercise that we had in the morning. Remember, as local communities, we are best placed people to identify, local sources that can provide utility to the surveillance system. So I think members who have access to their community platforms can check under the dashboard, the sources. They'll be able to identify how many sources they have, and they can also be able to map out which sources are lacking that needs to be included to improve the utility of this platform. I think once this is done, we were guided well that we share these proposed sources with the Afro office so that they can help us include them as our local sources. Thank you.
Thank you very much. So we've been hearing about these local community radios, about sources and collaboration. So Berlin Hub, not Berlin Hub, the pandemic hub situated in Berlin. Yeah, we're quoting. So Raquel, do you want to comment on this?
George, colleague, comment briefly, starting on sources, and thank you for the question and the comment. And maybe to brief those online, this morning, our wonderful EIOS champions here had a wonderful session where they dove deep into the sources currently available for their country and understood or tried to come up with a list of other many relevant sources that are needed within each of their countries. And this is something we highly encourage to all member states within the EIOS community to do on a regular basis. From our side, we actually have been working hard to build a new sources management editor that is going to be released over the next few weeks, and a few of you here in this room have already had a sneak peek of playing with it. This new sources management tool will support and enable communities have a much easier way to manage the way sources are included in the EIOS system. In addition, we have constant work trying to include more platforms, new social media like Telegram that is now available in the EIOS system, and much more. So we are working all the time, constantly trying to increase the availability of different types of sources, platforms, social media within the EIOS system. And we are always welcoming requests, needs from teams, and even offers of collaboration. And the more exciting part is the recent project that has been ongoing for a few years, but it's taking momentum on trying to incorporate radio sources into EIOS. And I could speak a bit about it, but I wonder if George would like to share more, given that the pilots are going to take place here in Afro.
Wow, I have become one of the panelists. Okay. So yes, as part of the sources, we've recognized in our region that the community radios are also very important sources of information. Particularly they serve local communities, they are on the ground, they know what is happening. So we've been thinking about how to include these local community radios on the EIOS system as well. So we are working now with colleagues from the OICT, the UN Organization for Information Community and Technology. They've done some work around this in different contexts. Along with our team here based in this hub, our data and information system and innovation team. So we're going to pilot with 2 countries, bringing in their community radios into the EIOS system and then learn from that and hopefully scale that up to the rest of the. So it's a project that is almost in, we are just about to start. And so in the next few weeks or months, we will get started. And we hope we will learn from that and hopefully move to other countries. This is what we call the speech to text project. And as we go along, I think during the course of the week tomorrow, you might hear more about that, what we are doing on that. And so we also, this is what this hub is about, also trying to leverage the capacity in our region in Africa for data science, for artificial intelligence, for this kind of innovation to be able to expand the initiative and move forward. So I think this ties in very well with the comment of Mercy, how we leverage this hub, for instance, to do and all the capacities we have in our different countries in the region to build on this very good EIOS initiative. So colleagues, I think it's been very wonderful interaction. Do we have any other question online? We might need to close. We are running late. How is AI being used to reduce the work done in conducting EBS using EIOS? So I think we heard there was a lot of particularly for those at HQ, Xylene is at HQ level, so they are dealing with thousands of articles on a daily basis on the EIOS system they need to scan. We at the regional office, we're dealing with thousands. Tomorrow you will hear about how we're using machine learning to build classifier on the EIOS system, using a supervised learning model where the system can learn from what we have previously detected as EIOS and use that to detect potential signals on the EIOS system. So we may not necessarily have to read all the thousands of articles. The system is doing it, the machine is doing it for us. And what we are looking at is what will be a potential signal on the EIOS system. So tomorrow we'll get a feel of that work. There's already some work going, some models that are being tested currently to help with that process. And we hope as we go along, these are some of the capacities and we can put forth with regards to that. So time is, we want to give the panelists just 2 minutes each to make their parting comments. It has been really great hearing from you. So Mercy, we'll start with you. Please give us your concluding comments in 2 minutes.
Yeah, thank you so much, WHO, for putting this up. And thank you so much, George, for this fantastic moderation. In conclusion, I think there's keywords that keep coming up: collaboration, partnership, engagement, and optimization of the system, integrating technology and leveraging existing capacities. I mean, those are the things that maybe going out there we need to go with and start working on. So, and I feel it's a collaborative effort. So it's not just WHO, but collaboratively as member states, as partners, we need to all support this just so that we are able to attain the envisaged capacity that we all wish for. Thank you for the opportunity and bye.
Thank you, Mercy. Anwar?
Thank you very much for the opportunity. And I think my parting word is that EIOS has demonstrated usefulness, effectiveness, and reliability in conducting epidemic intelligence. And I think we should embrace it. We should engage with the platform. We should expand its usage to ensure that the next pandemic will have zero impact on our lives and livelihood. Thank you.
Blanche?
I could say anything more powerful than what Anwar has already said. But I will just again reiterate my thanks for being invited to participate today. I've learned a lot over the past few days, and I look forward to continuing to hear a different perspective on how EIOS is being used. I think the one thing I would add is looking for more ways to share sort of our experience at HQ in One Health integration with our public health intelligence, and making sure that we're sharing that down so that it's perhaps a model that could be built on, or just, again, a sharing of experiences that others might find useful. So I thank the questions today for reminding me of that. Thank you.
Philip?
Thank you so much again for the opportunity. I think for me, I look at the evolution of EBS, and when we started, community event-based surveillance appeared to be one of the most effective model or method of conducting EBS. But with the revolution in the information technology, I think media scanning is emerging as one of the best and effective ways of conducting event-based surveillance. And the EIOS utility is one platform that supports media scanning. And I think moving forward, it is demonstrated its effectiveness in terms of reducing the costs that are required, reducing the human interface that is required, making the surveillance system very sensitive, and also timeliness, real-time detection and notification of these public health threats, which I think is the dream of any surveillance system. It's upon us to make sure that we leverage existing systems, existing resources, to make sure that we make it work and we make it sustainable. Thank you.
Thank you very much. Applicable 2-1, sensitivity, timeliness, very key, and collaboration, of course, from Maxi, very, very key. So again, we agree with me. This has really been insightful. We've really learned from these experts. They have shared with us their experiences and their thought processes on how we can strengthen this initiative going forward. So I want to say thank you so much, and please join me in giving these colleagues a very big hands of applause. Thank you so much. Bye-bye to your colleagues. Good afternoon once again. So I'm back after this discussion panel. So I'm back. So on time.